Okay, so this chapter goes over the male reproductive system and urinary systems for medical terminology. Male germ cells, the sperm, they're also called the gametes. And the terms we typically use for this include spermato, spermo, spermio. So spermatogenesis is the formation of sperm. Spermolysis is actually the destruction of sperm. So spermatolysis would also be a term for the destruction of sperm. They're saying here spermatoblast or spermoblast would be an embryonic male sperm cell. Not entirely true. We will go over that a little bit later. Spermatocyst is a sac containing sperm. Spermatoid is a term that you would use for anything that looks like or resembles it. Disease of the sperm would be spermatopathy. Agents used to kill sperm would be spermicides. Here's an image of the male reproductive system, and you can actually see, starting with the testes right here. So the testicles, the word we use for them is orchid or orchido. By the way, the testes are the primary reproductive organ of the male because they make the sperm cells. Also, we could use orchio, orco, or even testicle or testicular. So orchialgia means pain in the testes. Orchiodinea also means pain in the testes. You could use either term, and both are used. For the singular, it is called a testis. Plural is testes. Notice the difference. If you can't remember that, just use testicle, because to make that plural, you just add an S at the end. Testicular is an adjective referring to the testicles. So the process or the procedure of an orchidoplasty would be surgical repair of the testes. Cryptorchidism is actually a condition, they're calling it a hidden testicle, which is partly right, but crypt means hidden. This is the technical word for an undescended testicle. So as a fetus, the testes develop up in the abdomen and pelvic region of the male, and they descend shortly before birth. If they have not fully descended, then you have cryptorchidism. Orchidocele would be a herniation of a testicle. Orchidotomy would be an incision or cutting into a testicle. The prostate is an organ that wraps around the urethra as it leaves the bladder. The prostate contributes much of the volume of seminal fluid to semen. The words used here, prostat, prostato. So prostatitis would be the inflammation of the prostate gland. Prostatic is an adjective that means something referring to or pertaining to prostate. Prostaturia would be discharge or flow from the prostate gland. Prostatalgia would be prostate pain. And in this image, we can actually see benign prostatic hypertrophy. So the prostate should be about this big, and in this case, it's much larger. And what that does is it actually puts pressure into the bladder, making the bladder feel like it's much fuller than it really is, while at the same time squeezing around the urethra, making it harder for urine to come out. This is why many men, as they get older, have trouble urinating, but they feel like they have to go all the time. And by the way, the more popular term than this now tends to be hyperplasia. Still the same abbreviation, BPH, but hyperplasia is more accurate because the cells haven't actually gotten bigger or enlarged like hypertrophy would suggest. There's just more of them. The penis, This is the external sex organ. It is where the urethra passes through. At the very tip of it is the rounded tip of the penis is referred to as the glans penis. The medical term that we use to refer to this is balin or balano. So balanoplasty would be surgical repair of the glans penis. For the entire penis, really we just use peno or penile to refer to it. So if you had inflammation of the penis, you could refer to it as penitis. Penoscrotal refers to both the penis and the scrotum. Vas. Vas is the term we used for vessel, and if you remember, we saw that already with the blood vessels, but there is a little organ in the male reproduction called the vas deferens or the ductus deferens, and it connects the testicles to the urethra as it passes through the penis. Vasodilation would be enlarging the diameter of a vessel. This would have more to do with blood vessels than the vas deferens. Vasospasm would also be spasms of a blood vessel. A vasotomy would be cutting into a vessel or into the vas deferens. Vasorrhaphy would be suturing it. A vasectomy would be removing or cutting out a part of the vas deferens. This process would basically prevent sperm that's being made in the testicles from getting into the semen. The urinary system is made up of two kidneys, the ureters that run from the kidneys to the bladder, the urethra, and then in the male, the penis. So urine, the typical medical term we use for that is just uro. Kidney could be nephro or reno. Now, usually if we're talking about the whole kidney, we use the word reno. And if we're talking about any portion or inside or the physiological structures, we use the word nephro. The renal pelvis, the area the urine collects in before it leaves via the ureters, this is called the renal pelvis. Our medical term for that is pyelo. The ureter is a tube that carries urine from the kidneys to the bladder, and the only medical term we have for that is uretero or ureto. The bladder, since it's a fluid-containing sac, gets the word cyst. And the urethra, which is the place that carries urine from the bladder to the outside, doesn't have any fancy words. It's just urethra, urethro. A urologist specializes in the urinary system and the male reproductive system. Neuropathy would be a disease of the urinary tract. A nephrologist would specialize in treating kidney disorders. Urologists would typically be more of a second round, and nephrologists would be a final round of specialists. Nephritis is inflammation of the kidney. Nephrolysis is destruction of the kidney or kidney tissues. A nephrolith is the technical word for a kidney stone. Nephromalacia is softening of the kidneys or softening of the tissue making up the kidneys. Nephromegaly would be an enlargement of the kidneys. Nephroptosis, your book says, means prolapsed kidneys. Since it doesn't actually fall into itself, it doesn't intercept, the kidney doesn't actually prolapse. The kidney droops, and ptosis actually means dropping or drooping or falling. An intravenous pyelogram. This is a test that we deliver through the veins, and we put a dye in the veins that will then stain the renal pelvis and tell us what it looks like and where the kidneys are sitting. Notice this kidney is much higher than this kidney is. This is the one that's where it's supposed to be. This one has fallen, so the right kidney is going through nephroptosis. Pyelitis would be inflammation of the renal pelvis. Pyeloplasty would be the surgical repair of the renal pelvis. And pyelonephritis, this is inflammation of both the renal pelvis and the kidney's tissues itself. Pyelonephrosis is just a disease or a condition of both the renal pelvis and the kidney as a whole. The ureter, if you had ureterorrhagia, you have a hemorrhage of the ureter, for which you would need to perform ureterography or suturing of the ureter. Ureteroptosis would be falling in or drooping or dropping of the ureter. The ureteropyeloplasty, surgical repair of the renal pelvis and the ureter. Ureteropyelitis, inflammation of the renal pelvis and ureter. Nephrorrhaphy would be suturing of a kidney. Cystorrhaphy would be suturing of the bladder. Ureterorrhaphy would be suturing of the urethra. Urethorrhaphy would be suturing of the urethra. Urethrotomy would be an incision into the urethra. And urethrospasm would be a spasm in the urethra. The bladder gets the word cyst. So cystoplasty would be the surgical repair of the bladder. A cystotomy would be cutting into the bladder. A cystectomy would be removal of the bladder. Cystoscopy would be the process of looking inside the bladder. And this is an image of a cystoscope going into the bladder. This would be a test that we could use to look at and see if bladder infections were actually causing tissue damage. This is also a test. They don't have to go all the way up to the bladder. They can go just distal to the bladder and look at the health of the prostate. Cystoptosis is a falling or a prolapse of the bladder. A cystocele is a herniation of the bladder posteriorly into the vagina. This does actually happen. Cystorrhagia is the hemorrhage of the bladder. Cystoria is flowing from the bladder or dribbling. Cystorrhaphy would be suturing. And remember, we've seen most of these before. X means outside or out of. So to excrete is to actually make something leave the cell. D means less than or down from, so dehydration is less than healthy or normal hydration. Trans means across. In means either inside or not, depending on how it's being used. So remember, balano means the glands, part of the penis. Cysto means the bladder. Nephro means the kidney. Uretero refers to the ureter. Plasty is surgical repair. Scopy is looking. Pexy is fixation. And lith is a stone. So balanoplasty would be surgical repair of the glans penis, the tip of the penis. Cystoscopy would be the process of looking in the bladder. Nephropexy would be the surgical fixation of the kidney, and ureterolith is a stone in the ureter. A cystoscope is a tool you would use to look in the bladder. Excise means to cut. Polyuria means frequent urination. It's a sign of diabetes mellitus. Prostaturia means your prostate is running, it's leaking stuff.